Question number 1. Which of the following is a characteristic symptom of hyperthyroidism? The right answer is option A, weight loss. Question number 2. What is the first step in the nursing process? The right answer is option C, assessment. Question number 3. Which type of diet is prescribed to patient with a peptic ulcer? The right answer is option B, soft and plain diet. Question number 4. Which of the following is a common complication of diabetes mellitus? The right answer is option A, cataracts. Question number 5. What is the primary function of red blood cells? The right answer is option A, transport oxygen. Question number 6. Which of the following is a normal adult blood pressure range? The right answer is option A, 90 over 60 to 120 over 80 millimeter mercury. Question number 7. Which of the following is a sign of dehydration? The right answer is option B, dry mouth. Question number 8. In which condition is the use of an insulin pump most common? The right answer is option B, type 1 diabetes. Question number 9. What is the primary function of the kidneys? The right answer is option C, filter waste from the blood. Question number 10. What is the most effective way to prevent the spread of infection in a healthcare setting? The right answer is option B, proper hand hygiene. Question number 11. What is the normal range for body temperature in adults? The right answer is option B, 36 to 37 degrees Celsius. Question number 12. Which of the following is a contraindication for a blood transfusion? The right answer is option B, blood type incompatibility. Question number 13. What is the most common cause of chronic obstructive pulmonary disease? The right answer is option A, smoking. Question number 14. What does the Glasgow Coma scale measure? The right answer is option C, eye response, verbal response, and motor response. Question number 15. Which electrolyte imbalance is common seen in patients with kidney disease? The right answer is option C, hyperkalemia. Question number 16. Which is a primary risk factor for developing stroke? The right answer is option C, smoking. While the leading cause of stroke is hypertension. Question number 17. Which of the following is a sign of myocardial infarction? The right answer is option B, chest pain radiating to the arm. Question number 18. Which of the following is a primary function of the liver? The right answer is option A, detoxification of harmful substances. Question number 19. Which of the following is a side effect of opioids? The right answer is option B, constipation. Question number 20. Which type of shock is caused by a severe allergic reaction? The right answer is option D, anaphylactic shock. Question number 21. What is the first action to take when a patient is experiencing a seizure? The right answer is option B, ensure the patient's safety. Question number 22. What is the preferred method for administering oral medications to infants? The right answer is option B, using a syringe without a needle. Question number 23. Which of the following is a symptom of congestive heart failure? The right answer is option B, shortness of breath. Question number 24. Which of the following is an indication for the use of a Foley catheter? The right answer is option C, postoperative monitoring. Question number 25. What is the most common symptom of chronic kidney disease, CKD? The right answer is option A, edema. Question number 26. Which is a common side effect of chemotherapy? The right answer is option C, nausea and vomiting. Question number 27. What is the role of white blood cells in the body? The right answer is option C, fight infections. Question number 28. Which of the following is a sign of dehydration in elderly patients? The right answer is option B, dry skin and mucous membranes. Question number 29. What is the main cause of vitamin D deficiency? The right answer is option B, inadequate dietary intake. Question number 30. Which medication is commonly prescribed for hypertension? The right answer is option B, lisinopril.